There are 3 prescription medicines you need to be familiar with. These are bupropion, nortriptyline, and varenicline. Now obviously, because these are prescribed, your client is going to need to get these from their GP. However, you have a key role to play in giving your clients good, sensible advice about these medicines, including how they work, how to take it, and what some of the common side effects are. Bupropion is an atypical antidepressant that was found by chance to help people quit smoking. It works by alleviating withdrawal symptoms, making quitting easier. This medicine you need to get on prescription from your GP. You also need to start it at least 1 week prior to quitting. It's nice and easy to use, and your client will start with just 1 tablet once a day for the first 3 days, thereafter 1 tablet twice a day, keeping at least 8 hours between each dose. Advise your client not to take it too close to bedtime, as this will keep them awake at night. Now, not everyone can take bupropion. There are a number of contraindications. For example, previous head injury, a central nervous system tumour, anorexia nervosa. You don't need to worry about all of these because the GP will check this out. But keep it in the back of your mind. Your guidebook will also give you all of this detail. There are a number of drug interactions that also need to be considered, but your client's GP will look into that. The most common side effects associated with bupropion are headache, dry mouth, and difficulty sleeping. Most of these are mild to moderate, and your client is likely to tolerate them. There is a rare risk of seizure. The likelihood of that is about 1 in 1,000, and not dissimilar to other antidepressant drugs. The other antidepressant that helps people stop smoking is called nortriptyline. It too works by alleviating symptoms of withdrawal, making quitting easier. Like the other prescription medicines, it needs to be started prior to quitting. Your client's GP will check out that they're okay to take this medicine, and if they are, they'll tell them how to use it. Generally, it's an increasing dose over time, from around 25 milligrams a day up to 75 to 100 milligrams per day. There are some common side effects associated with using this medicine. The most common ones are drowsiness and dry mouth. Sipping water can sometimes help with the dry mouth. People should use this for at least 12 weeks, and at the end, the GP may advise a decreasing dose. The third prescribed medicine is varenicline, or Champix. Now, varenicline was designed especially for smoking cessation. To the brain, varenicline looks a little bit like nicotine, but it's not quite the same. If I can put it in this way, to the brain, nicotine would be a 100-watt light bulb, lighting up the brain. Varenicline is probably a 40-watt light bulb. It's enough to keep your brain out of the dark, but it's nothing like smoking. So varenicline works by alleviating the symptoms of withdrawal, making quitting easier. It also, though, has another effect, where it seems to block the rewarding effects of nicotine. Now, your clients may notice this when they start taking the medicine prior to quitting smoking. Like the other prescription medicines, it needs to be started at least 1 week prior to the quit date. Now, clients might come back saying, I know you told me to keep on smoking, but my cigarettes just aren't as enjoyable. And what they're explaining there is sort of this blocking effect of varenicline. But varenicline's main action is to reduce the withdrawal symptoms that are associated with stopping smoking, making quitting easier. Now, taking varenicline is pretty simple. It comes in a nice pack where people can just pop out the pills on the day. But essentially, you start low, 1 tablet once a day for the first 3 days, increasing to 1 tablet twice a day. The first tablets in the first week are all 0.5 milligram. Then they progress on to 1 milligram tablets thereafter. You should encourage people to complete the course of treatment. The full course of treatment is 12 weeks. Now, not everyone can get varenicline subsidised. There are some criteria that need to be met. For example, you have to have tried nicotine replacement therapies twice, or you need to have tried nortriptyline or bupropion. Your client's GP will check that varenicline is right for them. There are relatively few contraindications for taking varenicline. One is aged under 18, Pregnant and breastfeeding women can't use the medicine, but otherwise most people can. People with mental illness can also use varenicline, but like helping anyone with mental illness stop smoking, you should monitor their symptoms. The most common side effects of varenicline are nausea and vivid dreams, so make sure you inform your clients about these. Certainly taking the tablets with food will help nausea. The vivid dreams are not necessarily nightmares, and people do seem to cope with these, and they dissipate over time. Some people have experienced low mood whilst taking varenicline. New evidence suggests that this is not a causal effect of the drug, but probably likely to be due to tobacco withdrawal. Regardless though, you should monitor all of your clients when helping them to stop smoking, and if you're at all worried by any changes in their mood, refer them back to their GP.